Good afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to our emergency preparedness team in celebration of Emergency Preparedness Month. Year-round, this little-known team works to help businesses, churches, child care facilities, families, healthcare partners, and many others prepare for disasters. For the past 6 months, they have been working at an incredible pace and putting in long hours to help our community respond to this pandemic. They're doing things like assisting with the coordination of healthcare facilities and their response through the Knox East Tennessee Healthcare Coalition, providing planning and logistical support for our testing events, conducting training and education for new EPI response team members, providing data entry support, assisting with volunteers from our Medical Reserve Corps, and they are working on our COVID-19 vaccination plans to have them ready once the vaccine becomes available. This is a small but incredibly dedicated group of professionals, a group that I'm immensely proud and honored to be working with every day. A real life example of putting the 5 core actions into play is celebrating Labor Day this weekend. If you're hosting friends and family this weekend, try to keep the guests outdoors and encourage them to dress for warm weather. Consider reducing the size of your gathering. Encourage everyone to wear masks when they can't maintain 6 feet of social distancing. And ask those that aren't feeling well or those who have asked to stay home to quarantine to please stay home and not come to your gathering. And create socially distanced seating arrangements. Households can be seated together, but then the other groups need to be separated at least 6 feet. If you are attending a gathering this weekend, ask the host what their plans are so you can determine if they're adhering to the 5 core actions. Bring your mask and stay at least 6 feet away from those who are not in your household. And of course, if you aren't feeling well or have been told to quarantine, please stay home. We discussed this last night at the Board of Health meeting, but I want to pull up some data again as a reminder to our community of how holidays and gatherings can lead to an increase in COVID-19 cases. This first slide shows, can you go back to the first slide? That's the third one. Thank you. First slide shows Memorial Day. And Memorial Day happened right after the reopening. And so I ask that well, first of all, let's kind of set the stage here. If you look at the y-axis, the numbers on the left, make sure you pay attention to the range of cases on each of these graphs so you can kind of see where we stand. So in May, things were really starting to ramp up. This is where we had just come out of or entered the reopening phases, and people were starting to get out and about more, I think feeling more comfortable. And we still saw a jump in cases after that holiday, although it was a little bit smaller. Next slide. Next slide is Father's Day. And so you can see where Father's Day was and the 14-day incubation period, and watch our cases go up after that as well. And see, again, if you look on the y-axis on the left side, the number of cases were moving up to, I think, around just under 100 per day. And then the third slide is after July 4th. And again, we saw at the end of that incubation period, we were seeing a jump up to around 150 or so cases per day at that time. So basically what that shows is we're seeing increasing cases after these holidays, and we don't want that to happen again while we have other things going on in the community. Again, we're back in school. We have UT back, so there's a lot of activity and movement happening right now that we want to remind people that those 5 core actions still come into play no matter where you're going or no matter what you're doing, even at these social gatherings, these holiday events. Moving back to the prepared statements here. As a reminder, we are providing COVID-19 testing today and tomorrow at the Jacob Building from 9 a.m. to 3 p.m. Anyone is welcome, but we encourage testing among those who have COVID-19 symptoms, those who are close contacts of confirmed cases, and those who have had healthcare provider recommend they get tested. Next week, we will continue testing at the Jacob Building on Tuesday through Friday from 9 a.m. to 3 p.m. Please note we will not be testing on Monday, which is Labor Day. Now we'll move into the local situation. We have 148 new confirmed cases since yesterday's report, giving us 6,894 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 247 probable cases. 4,697 of our cases have recovered, giving us 2,382 active cases. 270 individuals have been hospitalized at some point in their illness, and we have 44 Knox County residents currently hospitalized. And we regret that we have 3 additional deaths to report today, bringing our total to 62. We extend our deepest sympathies to their loved ones. We'll now transition to the benchmarks. As a reminder, for a majority of the benchmarks, what we want to see is no 3-day statistically significant shifts with a 2-week time period. Every day we look back at the previous 2 weeks, that's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or are they getting worse? And if so, how much better or worse and at what rate? We will now pull up the data, and as a reminder, all of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and growth rate over time. We've seen both red and yellow flags in the last 14 days, but they were not on 3 consecutive days per the benchmark definition. Because of this, we're representing this benchmark as green. However, as Dr. Buchanan mentioned last night, we're calling this cautiously green because of the number of flags, while not consecutive are an indication of things beginning to trend upward. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Over the 14-day evaluation period, we saw some red flags for the number of tests conducted, but they were not on 3 consecutive days. Lab turnaround time does continue to decrease to less than a 2-day average, which is very good. This benchmark is represented as green, but just like the first benchmark, this is a cautious green due to the testing flags. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. We continue to be able to initiate investigations in this time frame, and because of this, our benchmark continues to be represented as green. With the existing EPI support teams in place, we are able to handle our current caseload. We will, of course, continue to evaluate this and make any appropriate changes as the situation evolves. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Region, or patients from other jurisdictions. We saw no flags regarding ventilators, ICU beds, or hospitalizations. That said, hospitalizations are slowly trending up. After speaking with our hospital partners, they stated this benchmark should be represented as yellow. The hospital systems continue to meet regularly, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all the data into consideration. Our fifth benchmark, sustained or decreased COVID-related death rate for identified positive or probable cases. For this benchmark, we use the graph that shows the reported deaths of Knox County residents by date of death. Over the past 2 weeks through yesterday, there were 4 deaths reported, which is down from the 6 we reported during our last update. Due to this, the benchmark is represented as green. While we're pleased to see with how the data is looking this week, we do expect the first 2 benchmarks may change next week. We will continue to closely monitor this data. And now I'll open it up for questions.
Okay, the first question we have is from Alan Sims with Inside of Knoxville. The number of cases over the last 7 days has increased by 45.8% over the previous week, clearly more than a statistically significant difference. To have a nearly 50% increase in a week and keep the rating in the good category seems odd. The benchmarks require 3 consecutive days of statistically significant increases to change in color rating, though with our erratic daily numbers, this may not happen. Is it possible there should be additional ways to look at the statistically significant changes, such as a week-to-week, week-over-week change?
Actually, we look at a lot of different information. So that is the 3 days of statistically significant changes in data is the line that's there. But we also can look at, we always say we look at all of the data. And so we do look at the full picture. We've seen the largest and most significant growth in pretty much one age group and one demographic. So that kind of plays into the decision making. And we do expect to see, and like we said in the prepared remarks, there's likely going to be a change in the color next week if things continue along this trend. But we did want to make sure that we're looking at all the data. We also have peaks and valleys. And so our averages, we're still looking lower than they had before, which is where we landed with a cautious green today. But I do want to remind everybody that there's a wealth of information that we look at and we consider when making these recommendations. And whether it's green or yellow, we still ask that everybody still follow those 5 core actions and try to do everything you can to prevent the spread.
All right, from Isabel with the News Sentinel. She's asked for a copy of those slides. And yes, Isabel, we will send that out through the Joint Information Center to everyone a little bit later. Jeff from WATE, late in August, it seemed like Knox County was doing better. Sub 1% day-to-day case growth on many days, several consecutive days with no deaths. Lately, we've had above 1% case numbers and now 3 deaths. What changed?
Well, I think that we've been talking a lot about all of the changes that were coming into the end of August. So again, just by the nature of schools being back and people interacting more, the university's back, and there's a lot more interactions there. I think we've talked a lot about expecting to see growth based on this. What we don't want to see is that it continues to skyrocket. So steady growth that levels out quickly and maintains where we can all respond and the hospitals cannot still respond effectively. It's something that we can manage. What we don't want is to see that rapid growth. And so we want to encourage everybody to, again, to follow those actions. But I really think that a lot of the numbers that you're seeing now are the changes from a couple of weeks ago with just more movement within the county and interactions with folks.
All right, Megan from WVLT. The CDC announced a vaccine is expected to be ready for distribution on November 1st. Has the health department received any communication about this? Is there a vaccine plan in place for making a vaccine available to residents?
So that's what we're working on now. We have received some preliminary guidance for some potential to have vaccine and have it available, and are looking at our plans and starting to bring together groups to discuss what these look like. We're starting with our internal group, and then we'll be expanding outside of there. But we've had plans in place. Again, I highlighted our emergency preparedness team, and that's just what they do is help to make sure that we have those plans in place. And so we'll just need to tweak them to make sure that we're meeting all the needs of the COVID response planning efforts and all the things that go along specifically with the COVID vaccine that may be coming. And there's a few of those, and they all have different requirements. We've also got a lot of practice doing this kind of thing and getting a lot of vaccine out through our flu mist that we do with school ed flu vaccine clinics every year. And so all of those things roll into getting prepared to do the COVID vaccine response later this fall, hopefully.
Daniel from WBIR has asked, to what are you attributing today's spike in deaths, active and confirmed cases? And then he's got a couple more: local schools, University of Tennessee. Clearly, this is concerning after a recent trend of decline.
Yeah, I think I've addressed that already. So if you need me to highlight more information, I can, but I think I did with one of the previous questions.
All right. Brian Hornback, one member of the Board of Health participated in last night's meeting while appeared to be sitting in a Starbucks without a mask for the entire meeting. Is this consistent with the 5 benchmarks?
If you are at a table and more than 6 feet away from others, I believe that it is. So I don't know what the particulars are on that, and you're more than welcome to reach out to that individual member if you would like. But you can sit at a table in a restaurant, and as long as you're maintaining your social distance, does stay within the benchmarks.
Okay, Abby with WVLT. These vaccines the CDC is preparing for, are they safe? And can you tell us more about the trial process and what has gone into ensuring they will be effective?
I can't go into detail on that. At this level, I think that those are more appropriate questions for the FDA or even the State Department of Health. And know that the FDA has spoken out, and National Institutes of Health and others on the robust process they have to ensure a safe and effective vaccine. And so, but I can't speak to the level of detail that I think you want here on that topic.
Isabel with Knox News. On Tuesday, Dr. Buchanan explained how KCHD determines a close contact. What is the KCHD policy for siblings that live with those who are told to quarantine? Is it safe for these siblings to go to school?
Trying to make sure I'm tracking on the thing. So the sibling is a close, okay, so we have a close contact in the house who's not a case, who's quarantining. Yes, we don't, unless that person becomes ill, those would be called secondary contacts. We don't go to that level to continue to quarantine we don't quarantine contacts of contacts, essentially, is I think the question that you're asking. Now, so I'm getting a question here. Maybe I'm not tracking.
I think, Isabel, that answers your question as far as like who is required to quarantine, but certainly
now,
if it doesn't, please submit that.
Yeah, and if the case is a contact, if the household contact is also a case, then everybody in that household has to stay. But I'm guessing you're thinking if they were exposed through a sport event or something like that, we do not quarantine contacts of contacts. And so, again, we keep a close eye. Those folks in quarantine are under daily monitoring. We're encouraging them to get tested so that we can follow up if they do develop illness and then quarantine their contacts.
All right, Megan with WVLT. Will life return to, quote, normal after the vaccine is available? And how will life change for everyday folks once vaccines are distributed?
You know, I think that's going to take a little time. So most of the vaccines that we're seeing, you're going to have 2 doses with some time between them. But I think we all hope that we get back to some semblance of normalcy as soon as possible. Believe me, our staff here feels the same way and would like to do that as well. But there may be some things that continue to change. I mean, meeting via webinars and things of that nature, those types of things. There might be some positives that come out of this that make things happen. But hopefully, I think that once we get a vaccine and there's a lot of folks that are able to get the vaccine, because again, it'll probably have to go out in phases just due to the volume of vaccine that's available, then we can hopefully get back to a sense of normalcy.
All right, Brian Hornback. During the public forum, the speakers did not give their address before their remarks, as they are required at City Council and County Commission. Is that list of names, addresses available to us? Will you continue not having them not provide their addresses?
I don't know the answer to that question. We're going to have to look into what we are able to provide there and with our law department and follow up with you later.
All right, Jeff with WATE. I bet my question is based on the same Facebook post as Isabel's. The post we've seen suggests that a family was told that one of their kids had to go home from school as a close contact.
Okay.
But the family was also told the siblings were fine to keep going to school.
Yes, that is correct.
Then days later, a different contact tracer instructed the family that the siblings must stay home too. But are you sure that the county versus state contact tracers are giving out the same info?
We'll have to look into that. If you guys want to send us the details of what you saw there, we can look into it. These are human beings, and sometimes there can be challenges with making sure everybody's saying the things the exact same way, the exact same every time. But also different stories can be given. So it could be that somebody, the case ended up, or the contact ended up developing some symptoms that would require them to stay home. So there's a lot of things that can play, but we can follow up individually with those and try to correct that if there was an error on our end.
Jeff or Isabel, if you'd like to submit that to the JIC, we can follow up with you from there. Abby from WVLT, what will we hope will happen to the spread of the virus when people start getting a vaccine? that local emergency preparedness group, will they try to distribute the specific areas first, i.e. senior living homes or schools?
Well, we'll follow the guidance that comes along from the state and federal government on what the priority groups are to distribute those vaccines first. And I think that is still being finalized. I have not seen the final priority groups at this time, but we'll follow that guidance and get it out to those groups as we did. And we have experienced that same thing if you were around the area, and I believe it was 2009 with H1N1. That was the same thing that happened there. And so there was very strict criteria for the first rounds of vaccine to different priority groups. Pregnant women and others were back in that phase. And so we worked with partners that could get to those populations. And we'll do the same thing, working with partners that can get to the priority group populations as we move forward with this one as well.
If there are any other questions, if you'll please submit them into the chat feature, the media will submit them into the chat feature. We'll get those answered. All right, from Isabel with Knox News. In a general sense to the question Jeff and I are asking, if someone who is quarantined develops symptoms of COVID,
yes,
when does it become required that their household contacts also quarantine?
As soon as they develop symptoms of COVID. So what that would make them is then a probable case. And we would treat them just like in a confirmed case at that point. So if you have what we call an epi-link, so a known link, so a household contact would be to a confirmed case, and you develop COVID symptoms during your 14 days, you're treated, classified as a probable case and then treated like a case. And we do interviews with you, the full investigation at that point, and then we do quarantine your close contacts based on that definition. And this isn't something that's new. Probable cases, case definitions, and our actions to that have long been around in public health for other diseases as well. And it's a way to rapidly be able to isolate and effectively quarantine close contacts of cases. But that should be the process that happens in those situations.
All right, are there any more questions? Please enter them into the chat feature. All right, seeing none, that'll be all for today. And we hope you have a great weekend and a very safe Labor Day, and we will see you on Tuesday.